Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over a quick mind map of hypertension. So if this is your first time tuning in, I've been doing these mind maps to give nurses and nursing students or even patients just a quick overview of a topic to kind of get all the information that they need in one place where it doesn't take a whole lot of time to get the information, especially with nursing students. I know we don't have a lot of time, so that is why I've been creating these. So let's get started. So hypertension. So hypertension is defined as a sustained blood pressure of 140 over 90 or above. Okay, so it would be sustained. So it would be elevated constantly above that 140 over 90. Now, we do want to know a normal blood pressure reading is classed as less than 130 over 80. Okay, so when it starts creeping up, the doctor will definitely be telling you that we need to watch that and possibly make lifestyle changes, which we'll get into in just a few moments here. So let's have a peek at the signs and symptoms. So signs and symptoms that people with blood pressure may notice is headache, blurred or double vision, regular nosebleeds, or shortness of breath. Now, there are two different types of causes. We have either primary or secondary. So we'll look at primary first. So this is also known as essential high blood pressure. It has no identifiable cause. Okay. Now, secondary high blood pressure is related to an underlying cause, such as kidney disease or a particular type of medication that they're taking. Now, diagnosis, we're normally using a blood pressure cuff where the doctor will use a stethoscope and put it on the artery here, and they start pumping up the blood pressure cuff. Okay, so this can be done digitally or manually, but that is really what we're doing is we're pumping up that blood pressure cuff to get a blood pressure. Now, risk factors. We want to look at risk factors. So age, smoking, obesity, lack of exercise, having high cholesterol, and even having a family history of high blood pressure. So treatment. There are different treatments depending on how high the blood pressure is, okay? So if it's just slightly higher than normal, we're going to use lifestyle changes. Moderate, so this is about your 140 over 90, we're going to use lifestyle and medication. And if it's very high, so 180 over 110, we're going to refer out to a specialist. Now, the most common medications that we're going to be using for high blood pressure are ACE inhibitors, calcium channel blockers, diuretics, alpha blockers, and beta blockers. So I hope this mind map has given you a better idea of hypertension as a whole and how it's treated, the causes, signs, and symptoms. But that's all I have for this video, guys. I hope you did find it helpful, and I hope to catch you in my next video. Bye for now.